Hey everyone, it's Jordan with Trauma. I'm going to review with you the setup for the EVD, not the maintenance, but just you need to put one of these in quickly. Here's what you're going to do. First thing is I recommend getting your trauma binder that's on your unit. Inside of it, I do have an EVD help guide for you. So it kind of looks like this. Turn to the right page and it will show you all of the equipment that you need and then step by step how to set this up. First thing that you need are a pair of clippers. That is going to be, I give it to my provider. They're going to clip the hair before that they put in your catheter. Another thing is sterile garb. Everyone in the room needs to be sterile. Gloves, gown, masks, hat, all of that, all right? And then you're going to give your cranial access kit to your provider. Whoever is inserting this needs that cranial access kit along with the catheter. The catheter it's literally a catheter that's going to go into the brain tissue and into that lateral ventricle, and it will hook up to our drain to collect that blood and CSF. All right, so all of that goes to my provider. Everyone is dressed out sterile, clippers, the cranial access kit, and the catheter to the provider. Please note that here at ILH, our cranial access kits do not have lidocaine in them, so you may need to pull that as well from the Omnicell. Great. The rest of the equipment is for nursing. This is what we will be doing as nurses to set up the EVD. First thing is I'm going to grab the drainage kit here, and I'm going to have someone else open this for me in a sterile fashion, and they will hand it to me. So once you have your drain, you can prepare that. Another piece that's in this drainage kit is your level. This is neon green. Don't get rid of that, all right? You are going to need both pieces. 2 preservative-free sterile saline flushes. You're going to need 2 of those, and then a transducer. It's a different looking transducer. There is no patient tubing. There is no fluid tubing. It's literally just a transducer, okay? And this is going to help give you ICP readings through the EVD. All right, I'm still sterile. I'm going to remove all of my excess baggage from this. Notice how we have 2 measurements up here. You have centimeters of water and millimeters of mercury. We're going to use centimeters of water here for our measurements. So you need this Buretrol to come down to the 0. That's way down here in the bright red. How do we get it down there? Pinch and bring this down. It does get a little sticky, if you will, so it might take a couple of times. That's okay, but you get it down to the 0. Once you have it there, you'll set that for a little while. Other stopcocks that you really need to be cognizant of, we have a 3-way stopcock here, right? And then you have one down here. This bright yellow one, I want you to make sure that it's off to the Buretrol. When you get it out of the package, it might be this way. I need it off to the Buretrol. What that does is it allows CSF to drain into here and not your bag, okay? You don't want it going into the bag until you know exactly how much is being collected. Okay, so off to the Buretrol, I'm good with that. Now let's come back to this stopcock here. This red cap, the super duper important red cap as I like to call it. Remove it, place it on your sterile field. Take your transducer and you're gonna pop it in right where you left off, okay? Twist it around, tighten it up, like so. I like to have the flat piece to the back, just like that. This is your red pressure cable, all right? So the exact same cable that you're using for art lines, this is what you're gonna use for your EVD, okay? Remove the cap from here, and then you're gonna take one of your sterile preservative-free flushes. I'm using a regular one right now. And you're going to start to flush your EVD, okay? So, sterile preservative-free flush, the gate is opened. Now we need to work with the stopcock. This is your drainage line going up. Down is your patient line, okay? I like to prime the patient line first. So I will turn it off to drainage and start to flush, okay? It takes about a full flush for all of that fluid to get all the way down through your patient tubing, all right? Once all of that is flushed, I'm going to turn it off to the patient, and now I'm going to prime my drainage. And so you'll be able to see some of that fluid going into my Buretrol, all right? Remove your sterile preservative-free flush. Turn here, you're gonna wanna close your gate and replace with that super duper important red cap, okay? Let's say that you have a patient coming out of the OR and they didn't have a transducer on it. I want you to prime the transducer with the sterile preservative-free flush, remove that cap, place it on, and and put your cap back on. We want to get a transducer on here so that you can measure ICPs with your EVD. All right, next thing I'm going to do is I'm going to grab that level that I was using before, or that I pulled out of the box, and on the back here I've got a hole right there, okay? I'm going to just put the level in there. Oh, it's a big click. All right, this is what I'm going to use to level it to the tragus of the ear, okay? I'm set up, I'm ready to go. This is ready for patient use as soon as the provider has inserted the catheter. At the end of this tubing, it is a luer lock, and it just luer locks into the catheter. The provider will put it together, okay? Once that is done, this is no longer considered sterile, so I'm just kind of hanging out waiting for my provider. In the next video, I'll show you guys how to hook it up to the pole and how that we manage the stopcock for the patient. Thank you.